In lymphatic drainage, there are a couple of different techniques. One is effleurage, which means to skim or touch lightly upon the surface. This is used in Swedish massage, and you could use it to warm up an area or to also clear an area after you've done some of the lymphatic pumping. Now, it's pretty simple. You could just go over an area. Usually you're going to be moving in an upward direction on the leg, and then you could just skim the surface just to get a nice broad contact to drain everything superficially. You could do it with the flat of your hand, or also with, some people like to use the side of their hand, and you're kind of stroking up and then letting go, stroking up, letting go, stroking up, letting go, stroking up, letting go. You can also use gentle circular motions in one area. So you would just touch lightly upon the skin, so you're just contacting it. You can reinforce your hand gently, and then just do pumps in a circular motion. And as you're moving through like this, you're stretching the skin, and then you're just letting go. Stretching the skin, letting go. Stretching the skin, letting go. For a two-handed pump, you would take one hand above, one below. I usually like to make a shape like this with my hand, and then you would stretch the skin above, use your bottom hand to also stretch the skin, and then relax. Move up a level, stretch the skin, and let it go. Move up a level, stretch the skin, and let it go. And repeat. So that's the double pump. So you do one hand stretches, then the other hand moves it up. Let go. One hand stretches, the other hand moves it up. Let it go. One hand stretches, bottom hand stretches, let it go. For edema strokes, let's assume the client has some swelling in their lower extremities in the legs. Now, some people would use a couple fingertips, but when you have a broad swelling like this, you'd want to use a broad hand contact. So you would take the entirety of your hand, place it down, and then place your bottom hand down, and you do more of those pumping strokes with more of a broad contact, and it'll just be easier to drain some of that fluid if you use a broad contact and stretch the skin that way. If someone has radiogenic pain, varicose veins, or just pain as you're doing the treatment, then definitely don't keep going and get them to consult a doctor. So there's something called the stretch phase and the relaxation phase. You want to make sure that your pressure is gentle to not overtax the vessels because they have a diameter of less than 1 millimeter. Now, you want to place your hand down in the stretch phase, and then you're just stretching the skin gently, just enough to get a skin stretch. So what you're doing when you're doing this stretch phase is you're increasing the interstitial pressure, and it's helping to form more lymph and push it along. So after the stretch phase, when you stretch the skin, then you're going to just barely maintain contact with the skin and let it relax. The lymph gets passively carried out of the tissue in this phase, and it also helps to create a suctioning effect as you stretch and relax, and it's helping to push the fluid along in the direction that you're moving in. So as we did before, you could stretch the tissue gently, and then you just very subtly, you maintain contact, but you just allow the tissue to return to its original position, and then you'd stretch and pump again, relax, stretch, relax. You'd go in a rhythm of 1 second, so you could be 1 Mississippi, relax, 1 Mississippi, relax. And you'd want to repeat that process usually 5 to 8 times in one area before moving to the next area. Deep diaphragmatic breathing is done at the beginning of treatments or always during treatments just to open up the deep lymphatic vessels in the abdomen, and it's good for overall drainage. Now, when you have a client, you can get them to place one hand on their abdomen, and you can place your hand over, and you can get them to place one hand on their chest. So you can place your hand like this, or you can just let them do it as well, whatever you're more comfortable with. So you'd get them to take a deep breath in through the nose, and you'd want them to fill up their belly, then their chest, and then out through the nose. So you're creating this pump through the body that's helping to open up the lymphatic vessels, and it's helping with drainage. So you'd usually do about 3 to 5 of these at some point during the treatment, usually at the beginning and the end. So we would usually open up a central and proximal area before going in and doing a treatment because it helps stagnant distal fluid be drained through the body. So usually you're going to start with deep breathing, and you could also start just above the clavicle in the supraclavicular fossa. You could place a couple fingertips down and just gently move the skin towards the middle and in like this, just gently, and you do that about 5 to 8 times. So let's assume that we're working on the chest. We would want to open up the lymph nodes in the neck and also in the axillary space. So you'd bring their arm up, then you would come over, place your hand in that area, and then gently move the skin and pump the nodes in the axilla 5 to 8 times. And then after you've opened up these 2 areas, you would start to work on the chest.